Good afternoon, St. Lucia. Welcome to a very special conversation that we're having in observance of World Cancer Day. That observance was on February 4th, 2022. In St. Lucia, Ministry of Health doesn't just want to have the activities concentrated simply on that day and then we move on with the rest of our lives and totally forget about the whole commemoration. We want to be able to keep cancer front and absolutely foremost in mind, because cancer has been devastatingly affecting St. Lucia over the years. And increasingly, as we'll hear from Dr. Owen Gabriel in just a little bit, increasingly we are finding more St. Lucians fall into the dreadful disease in various forms. In 2020, cancer accounted for nearly 10 million deaths worldwide. Now, between 2018 and 2020, in St. Lucia, we had over 3,700 new cases of cancer being diagnosed. Cancer such as prostate, lung, stomach, colon, cervical, ovarian, and of course, breast cancer. Now, this is staggering for me. In 2020 alone, we had some 1,274 lives lost to cancer. This is staggering. So what are we doing? How are we going to address the situation? Globally, there's a campaign that has been launched for a 3-year period, and that campaign is looking to reduce barriers to the care in cancer. The theme is close the care gap rather, and the Ministry of Health here has added to this a sub-theme, and they've added show concern for cancer. We'll be talking about closing the care gap, how do we show concern, and all of the issues here within. Some of it good, some of it bad. Some of it would mean putting up a mirror to see exactly what we're doing right and where we're falling short in order to truly close the care gap. With me, as I made mention a little earlier, Dr. Owen Gabriel, who is no stranger to St. Lucia and the rest of the region, I dare say, who is an oncologist. He's with us. We have also Dr. Franklin Bray, also no stranger. He's a psychologist as well as a pastor, and that's also looking towards the holistic care of the cancer patient. And speaking of cancer patients, we have with us Mr. Francis Daria, who is a survivor. Part of that holistic care as well, we have with us on the Zoom platform, no stranger to us here, she's like family right now over at NCN. We want to say hello to Ms. Fadia Campbell, who's a nutritionist within the Ministry of Health, Wellness, and Elderly Affairs. Everyone, welcome. And as always, I'm always excited for us to get through this conversation. Doc, we want to start with you. When you hear those numbers, and I say that it is staggering, it's absolutely a cause for concern. What we have seen, and if you could give us, if you will, a sort of diagnostic analysis of why is it that we are seeing so many deaths occurring from cancer right now?
Okay, well, thank you once again for having me on your program. I'm happy that this is not reduced to an panel discussion as we usually do, and we've done over the last few years. So it shows that the Ministry of Health is at the forefront of putting cancer, in the public light. And so it's important for us to do that now, because as you've said, the numbers, the 10 million cancer cases around the world in 2020, and the 3,000 plus cases we had in St. Lucia as well, and the over 1,000 deaths, that I'm happy these statistics even exist in the first place. We did not have the opportunity to have some of those statistics before, and only out of collaboration with the Ministry of Health and the clinicians and surgeons, we've been able to compile a sort of a registry, a cancer registry, to speak to this. So it's important to have that statistic. But what the truth about it is, what happens at the level of patients and their families, their communities, their work colleagues, and so on, the impact of cancer in St. Lucia. And the common ones, as you know, are prostate cancers, breast cancer, and prostate cancer in men, breast cancers in women, cervical cancer as well. I mean, for me, going through this, we found that St. Lucia ranks in the first 20 for age-standardized deaths for 5 cancers. So uterine cancers ranked number 19 for age-standardized death in the world, followed by breast cancer at number 17. Then we have cancer of the colorectal cancer. Prostate cancer is ranked number 11 with 49.8 per 100,000 deaths, age-standardized deaths, and things like leukemias and lymphomas as well. So it's important to that a small country like ours, that this ranking, 5 cancers rank among the first 20 countries in the world for deaths. So it's important to know that deaths are a result from whether it is person's lack of early diagnosis, or diagnoses that are advanced stages, as well as maybe a combination of access to care, affordable care, the variety of care opportunities that we have, including chemotherapy, radiotherapy, and surgery. So all of these factors will impact on the rate, which is closing the care gap. Not simply focus on the treatment component. It focuses on the component of early diagnosis, screening, and the whole process of becoming properly managed as a cancer patient. And it's somewhat, maybe in an imbalance, focuses on maybe what facilities the government may have available. But I dare say that it's important to see and to emphasize that individuals have a role to play in their own cancer journeys. So prioritizing your health in a general sense will lead to better outcomes. Screening, diagnosis, all are part of a positive outcome.
But I think to that area as a cancer patient, you know that cancer is out there, it exists, but never does anyone really think that it's going to happen to me, that sort of thing. It's not going to happen to me. So in terms of how do we now tailor programs, how do we now begin to get the message out that irrespective of who you are, cancer is a threat and you can fall as a cancer patient?
Oh, absolutely. I think, the theme this year speaks to that very issue. So closing the care gap speaks to the disparities that exist among, particular individuals or groups in the society. And certainly there are people who are more informed about cancer in the first instance, but because of exposure or their own curiosity and inclination to research their health statuses. There are persons who are more inclined to doing exercise, physical exercise, living a healthier lifestyle. But the schools, at the very early ages, it is important for us to inculcate the whole habit of lifestyle habits of healthy living in our children. The Ministry of Health engages in reducing child obesity, for instance, which is known as a factor in cancer, obesity in general. So that requires the parents and the family's intervention as well, because you can't preach something in the schools, but if it's not being practiced at home, then you don't have that child developing those types of patterns and habits that we would like them to do. So I think there's an opportunity for the whole of society to come on board, not just the family, the schools, the governments, and the health services. We have to work together, a common program to address this problem.
And I think too, at the individual level, some people say, well, I'm doing all of the right things. I'm eating healthy, I'm exercising, I'm at a healthy weight. And yet we do have individuals who are the most healthy and they can be diagnosed with cancer. So just on the disease level, can you explain to us why risk factors and risk behaviors are not the only things that contribute to a cancer diagnosis.
That's right. Cancers are developed from a mutation that occurs within the genes of our cells, the nucleus of the cells. And those mutations can be either intrinsic to that cell, which means that it might be genetically determined. So very minimal, they say 5 to 10% of cancers are inherited, hereditary cancers. So it means you're born with that gene mutation. Subsequent to that, there are also the extrinsic or external factors, the environment, exposure to the sunlight, your eating habits, your lifestyle habits, consumption of alcohol, smoking, unhealthy foods, in your diet especially, the lack of exercise, as we said earlier on, radiation exposure, viruses. We know of the human papillomavirus, very well known for the incidence of cervical cancer, a sexually transmitted disease, and bacteria. There's some bacteria that are well known, and a number of chemicals, ordinary household chemicals, for instance, we know of. The World Health Organization has classified household cleaning items, that can lead to that cancer. So it's all another, so the others that impact those mutations, enhance those mutations that will eventually lead to the development of cancer.
And before we get to Dr. Franklin Bray, I wanted to speak with Mr. Francis Daria. For you, tell us when you received your cancer diagnosis, and what were you experiencing before you knew that it was cancer?
Thank you, Lisa. Good afternoon to everyone. Well, I was living with cancer with all my strength, all my ability to do whatever I wanted to do. I never thought I was a cancer patient until I got my diagnosis in May of last year. Prior to that, after my retirement, being I grew up in the country, I moved on to work on a farm with my cousin because I love farming, so I was doing farming with him. And I used to do any and everything, you name it, manual work. It was a joke. The only thing I could not do was to climb trees, but I used to do everything. And I was feeling stronger at age 66, more than I was when I was 40, 45, 50. I thought I was at that time the strongest man alive, because my cousin sometimes used to joke me and he would tell me, for my age, being a police officer all my life, and after retirement, to have that kind of strength was something beyond comprehension. Just so suddenly, a day I went home from the garden and I felt a little fever. So I said, well, it seems that I was coming down with the flu. I knew I did not have COVID because I had just tested twice within 7 days, because I was close to someone who tested positive. So I took the test and I was negative. So I knew I wasn't coming down with COVID. I took 2 tablets and I went to rest for about half an hour. I got up, then I was feeling good. Nothing never happened. I had my supper, I went to bed. Next day, same thing. Now this happened to me a few times. So, working with my doctor every year. I used to have my checkups. Then I said, okay, maybe it is time for me to see what is wrong with my body. I went to do some blood tests and so on. Everything seems to be okay. The only thing the doctor found that was wrong was my blood count was a little low. So he said maybe because I have sickle cell trait, maybe this could be the cause. I was given medication, and then I sent back home. But when I went back to him, he saw things were picking up. But he told me, for the kind of activities, the strength that I have, the things that I do, we will not leave it there. So he sent me to an internist. Investigations were done, carried out, until he found that it was necessary that I did a colonoscopy, which is the procedure that you push a camera through your anus and then it inspects your colon. Mm-hmm. And then my ascending colon was found that it has 2 tumors. So then samples were taken, and I was sent back to my doctor, the internist. And then after the test came out, it was positive for colon cancer. So I want to say something here. I have tried to explain to people. I just cannot find words or phrases or statements to explain to people what it is like to see you are not on a bed, you have no ache, no pain, and then a doctor is looking and telling you you have cancer. Or around the people put cancer to be a death sentence. But I am telling you from experience, it is not. And I will tell you why. So coming back to my story, what that gave me, because when he told me that you have colon cancer, Dr. Bray came to my mind, and I will tell you why. Because when his mother-in-law lost, he preached at the funeral, and then his sermon, I can remember, was entitled, "It's Only a Matter of Time," something like to that effect, Dr. Bray. Right? It was only a matter of time that each of us would be lying down in the box, and I saw myself, especially about 3 months before that, my aunt passed, and then I even gave a speech at the funeral. And a day I was driving past by Rambali's parlor, and I said, "It seems very soon I'll be resting here." So I'm just trying to tell you, it is not easy to hear that. So a little relief came when I had a CT scan done. After the scan was done, the doctor asked me whether I was on any being given chemo for your problem. I said, "No, doc, my doctor is awaiting the result of this examination to know what to do." Then he told me, "Don't worry, you'll be fine. It is well contained. It is not inflamed. There are no leaks. No, there's nothing to worry about. They will just take it out." And then this brought me right back to my decision of having my test done every year. In our society, men were afraid of checking with our doctor. And it's a good thing that I was not like that. Because a day I was walking down the road and 2 guys were talking, one was washing his car early in the morning. And then the guy gave him a drink, said, "Des garçons, ou pour comme and go and wash a car." So they were just joking, and then, the talk started, about, we take care of our vehicles more than ourselves. And then growing up in church, they always put one thing first, health. As a police officer, I always knew to protect somebody, you have to protect yourself. You cannot go on the battlefield being a coward or just anyhow. You must go with a plan. And from then, I made a plan for my life that I am going to get tested every year. And this is what saved my life.
Dr. Bray, while Francis was speaking there, I'm thinking, you interface with individuals as cancer patients first at the worst possible time. And he spoke to when receiving the initial diagnosis, that aspect of the denial, refusing to accept at first this is what it is, in providing the psychosocial care for individuals, what is foremost in mind? What is the sort of end goal, if you will, when you interface with cancer patients, and how do you get them to begin to go through those stages of sort of mourning? It's because it's a loss that you're encountering. Because as he said, you are seeing your death, you know. So, and we go through so many emotional stages within that minute or two that you're seated in front of a doctor telling you that, I'm sorry, but we see that you have cancer. So how do you now begin to deconstruct all of those emotional stages that someone is going through, to allow them to begin to get through, if they can, a healthier place mentally, emotionally?
Yes, let me thank you for the question. Let me thank you for allowing me to be here, privileging me with this, the honor of being here. When a client comes with a cancer diagnosis, based on and the information received from the individual on the type of cancer, what stage is that, you're better able as a clinician to walk the person through possibilities and how best to look at the situation. You are able to have a conversation around lifestyles, future lifestyles, what can be done to really help improve the situation despite what the diagnosis is, how best to interpret the information, having the facts takes hold of your body, of your mind, and your life is now interpreted in terms of the shortness of time. This is what is going to happen to me. I don't have much long to go. The negativity can really help determine a shorter lifespan than than having a positive mindset with the attitude that I'm going to enjoy the rest of my life. I know I have this diagnosis. However, these are some things I can do to help me go through and enjoy the remainder of my life. And having a mindset where this is not the end of my life really helps. For example, when I see a client or a member who says, Pastor or Doc, this is what was said to me. I have X amount of time. The first impression that I have that comes to me is, this person is aware of how important time is. I need to understand that time is precious to that individual more now than ever. And I need to help them enjoy the rest of their life. So everything has to be realistically positive. Speak to the issues, speak whatever challenges that they may have, that they may wish to settle within that time frame. Speak to it and practically do so to help them go through it. But never would I raise the red flag and begin to look at gloom and dooming situations. The process of going through the diagnosis or leaving the diagnosis is very important if a person is safe.
Emotions as well, because I think that for cancer patients, and Francis perhaps can bear me out on this, there is a degree of guilt that you think, and guilt not so much that you may necessarily die, but guilt of having to leave your loved ones.
Yes.
How do we navigate as cancer patients through?
So the shock of diagnosis, the anger perhaps, how did I do that to myself? Self-blame can set in. Was it so and so that I did, you know, you would walk through almost immediately, have a rush through the years you've lived and see what you may have done that you may not have been careful and all of that. And even when you have been, you would now begin to question why you needed to have been so careful and all. So the mental confusion can be quite painful, distressing, and before the individual comes to the point of accepting, though having heard, but they may not, some persons are reluctant to accept, this is what I was just told. I was just told that I have cancer. So the confusion, the mental agony is going to be, and to sit with the individual and help them process the information. The anger is going to be there, particularly if the individual may have gone through an experience where perhaps engaging in activities that others may have considered to be negative, smoking, drinking, perhaps as a gym person, taking in so many supplements, ourselves for all of that. So it's very important for the therapist to walk the individual through and minimize, cut short in a very practical way, the self-blame and the anger, the self-rejection that the individual may possibly go through simply because everything is now being interpreted in terms of death. Even when the individual has a chance of living 10, 15 years. In the case of some individuals who may have early diagnosis, they see ultimately, I brought this upon myself, I am to blame. And so helping the individual appreciate what it is can really add years to their life.
How does the why me question fit into all of this? Because Life Francis, he did all the right things, went to his doctor yearly, he lived a healthy life, active. I would ask, why me? And put it this way, why me, Lord?
Right.
Self-pity party. And from experience, that headspace is not a good place to be in.
Yeah.
So let's talk about how we address that.
So, in a very practical way, let me say this. Based on where the individual is in the faith tradition or in the spiritual walk, the journey with God or the spiritual walk altogether, my approach would be different. An individual who has no inclination to believe anything divine, anything spiritual, answering the question, why me, with a biblical position, you the conversation, someone would have dropped off that right very early. So it's important to explain in a very in ways that are practical why you're a human being, you are predisposed to those possibilities. The spiritual aspect of it, we would reason that God ultimately knows what is best for our lives. However, to translate that into something that is pragmatic, we also have choices. And we should exercise those choices. We should make wise choices so that we can live healthy lives. So there is yet there is this physical aspect, this mental aspect that must be spoken to. You as well as the one who's speaking to you now, can be an individual with any of the situations that life has to offer. Because we don't know the future, we simply have to make the best decisions now to really help us enjoy whatever the future comes with.
Fadia, we're coming to you in a bit, but I want to bring back Dr. Gabriel into the conversation. In terms of the doing the right thing, there are certain conditions that individuals would have, and even though they're doing all of the right things, that can make them predisposed, as we discussed earlier, to cancer. Look at women, and for me, having been diagnosed with endometrium cancer, having for every day of every month to having cancer. I knew that all of the women in my family I always wanted to simply remove. And once I had an aunt who passed, and then we were told it was uterine cancer, I just felt I just needed to get it out. But I couldn't get it out because being told by the healthcare provider that, really, it's really against the law, a woman, young woman, child thing, and see, they're not able to. I was being treated for the PCOS. I had to be on pills, tablets, in order for me not to have bleeding episodes. So, women, because if for us to really have true rights for our reproductive health, making some of those decisions, how much leeway do we have in order for us to say firmly, this is what I want, and for us to be able to be given that? Because I can tell you, when I received my diagnosis, I was angry. Angry that I had seen that this was going to come and it would have happened. And I knew that if removing the womb at that time, that would have prevented me from getting to that stage. But there I was, unable to make that happen because policy decision would not allow.
Yeah, that's. I think I'm happy that we're now delving into the philosophical and some ethical aspects of cancer care. And I think you're on point, because when you speak about closing the care gap, the availability and accessibility to more sophisticated interventions, like for instance, in this case, we now have the ability to define a number of genetic profiles that will say to a person, your risk of developing one particular type of cancer or the other is such and such. And therefore, and the very common example that we use, for instance, is the BRCA test that we use for breast cancer patients, where if you in your family, a mother who has had breast cancer is tested positive, then her daughters are tested for, and her sisters, for instance, are tested for BRCA, the BRCA gene, and if positive, it will say to you that you have between a 55 to 80% risk of developing a breast cancer or an ovarian cancer, let's say. So therefore, for instance, the most well-known example of this is that of Angelina Jolie, who had a bilateral mastectomy because both herself and her mother were tested positive for breast cancer. So her mother had breast cancer, but she prevented this because her intervention, the removal of her breast, was prophylactic, and therefore she didn't develop breast cancer. So that would have been a good option to explore. And closing the care gap is having that knowledge that in your case, for instance, there may have been some genetic profiles that we could have used to determine your risks and so on because of your family's histories and so on, and other individualized factors, to say that maybe it's a better option to opt for such and such a thing rather than another, and prevent you going down the journey of being diagnosed and all the consequences of that, psychological and emotional.
But how readily available are these gene tests? Because I think that is the key. here, how readily available, and not just in terms of conducting the test, but accessing it, the finance aspect of it as well, because I think in closing the care gap, the deaths that we've seen, I dare to say, it may be one of the high contributing factors, people delaying, not being able to access the treatment and so forth. So how accessible it is for us to get these tests done, these gene tests done?
Well, as you would imagine, you know, all these sophisticated tests require a lot of financing for them, and none of these are available locally. Most of them we have to order for overseas labs to conduct those tests for us. But I mean, there are ways and avenues to accessing those tests if you have the financial capabilities. And I would say to people out there that Ministry of Health, there are facilities and resources within the Ministry of Health and the National Community Foundation where certain amounts of monies are available to persons treatments, whether it is in cancer or that those may be accessed by through the guidance of the doctors who would advise of a particular plan of action, and so on. You may access those resources to fund that kind of thing. So it's not readily available, and this is why in our setting we try to focus on prevention rather than cure. Yeah. And so screening and early diagnosis are the pillars of cancer care in St. Lucia until we become, you know, resourceful enough to algorithms that are available within St. Lucia or in the region at least.
So how do we know in terms of, you know, because Francis was speaking about persistently feeling a particular way unwell. You know, close a family member recently got a diagnosis as well, and that individual had been to but cancers that are just problematic to detect in their very early stage.
Yeah, I'd say mostly the majority necessarily cause compression or affect the skin, the nerves, and so on, cause pain at the onset. Those would be those that are subtle and in some ways occult, you know, that you only determine, you only find them if he didn't have his colonoscopy, unless he had severe abdominal pain, bleeding from the rectum, weight loss, and so on. He would not have known that he needed to investigate his gastrointestinal tract. So that is why, as part of screening and early diagnosis, for instance, in women, we say you must have breast examinations, mammograms. In other countries, at age 50, everybody's required to have a colonoscopy, a baseline colonoscopy, especially if you're at high risk. You know, you have a family, you know, factor involved. So he would have had at 50 that colonoscopy to identify these early lesions for colon cancer, which are some polyps, where they usually start off. And therefore you're able to act on them before they transition into more complex, invasive versions of the cancers. So, you know, I mean, we need to consolidate the efforts in screening and early diagnosis. It's not cheap, but it's the better option than to just treat cancers once they have developed.
Right. Let's bring Fadia into the conversation. Fadia, over there in Zoom land, in terms of, you know, the damage for cancer patients, in effect, the damage has already been done. And you want to be able now to embark on a lifestyle where you sort of reverse that damage and to put a stopgap to anything else developing. So talk to us about the sort of nutrition. Are you with us? Okay, I think Fadia is just a tad bit frozen there. Talia, if you could hear us, perhaps you may need to restart the computer. Roger, is that what it is? Is she back with us? Okay, so while we get Fadia sorted out, I want to ask Francis, after the diagnosis, are you with us, Fadia?
Afternoon.
Okay.
Can you hear me? I think I froze for a moment.
Yeah, you were just
so I am
there.
Another device.
All right. Did you have a question? I was asking about cancer patients. Once that diagnosis comes in, the thing is we need to reverse the damage. People are anxious to almost use nutrition as a stopgap measure to prevent anything further from happening. So in terms of a nutrition plan for a cancer patient, what is the advice?
Okay, thank you so very much, Lisa. And good afternoon to everyone. Good afternoon to fellow panelists. Thank you for having me. In terms of cancer and diet, there has to be basically an individualized plan. Because sometimes in terms of the kind of therapy, chemotherapy, these patients would need to have an individualized the transition prevention to when we speak about modifiable risk factors, and diet, as we have seen, is a modifiable risk factor that can actually help to prevent cancer, because there it is, we're seeing there is research to show that there is a link between your diet and cancer. So that is why, as a nutritionist, what I encourage is to add variety to your diet. And we're looking at foods that are more plant-based. And why plant-based? It is because of the amazing ability of the compounds that are found in plant-based foods, what we call phytonutrients that are cancer-fighting agents. So you speak about the vivid colored foods like the greens and the reds and the orange. So that is why we emphasize a lot on fruits and vegetable intake and grains and seeds as it relates to prevention per se. All right?
Now, I know that for some of us, we may go overboard and we want to completely strike out certain things that we believe are not the healthiest. People say absolutely no meats or whatsoever. And even talking about the plant-based diet, is there such a thing as being too extreme in the manner in which you want to eat? Do you open yourself up for being nutrition deficient in certain areas?
Of course, absolutely, most definitely. You want to strike a balance as it relates to nutrition. So that is why we encourage groupings, and you speak about your staples, you speak about your legumes, that means your peas, your beans, nuts, fruits, vegetables. So you want to strike a balance when it comes to nutrition, because no one type of food will give the nutrients that the body needs. And even when we speak about, cancer and prevention and diet, you want to restrict or minimize foods that are high in what we call saturated fats, or animal products, or protein foods from animal products. You want to minimize also foods that are processed. Even what we do with our foods become important. How is it prepared? You want to, as much as possible, avoid foods that are charred, or as we say, burnt or seared at high temperatures that would you do not want these foods because they tend to be carcinogenic. That can lead to, of course, your risk for developing cancer. So that's important, a balance when you speak about nutrition. So you can
charred now is into everybody, talk about and everybody wants to spice it up, and now there's a sort of restaurant trend where you go and you're having grilled vegetables, and I know that our vegetables are very special foods, and they need to be as close to natural as possible in order for you to benefit from all that they have to offer. So talk to us about how we treat the vegetables, how we cook them, and how that affects the level of nutrition that we receive from these foods.
Okay, great. So in terms of vegetables and preparation, like you said, now we are realizing individuals are roasting the vegetables, but that is a very, very heavy to cook. And in as much as you can eat your vegetable and it's raw state, it is more beneficial to the body. And even when you decide to steam it, it has to be within a short space of time, because the nutrients in there, for example, vitamin C, can actually be lost during the process of if you were to overcook vegetables. So organic foods are so very, very expensive. However, again, ourselves consume them as compared in a can, that would impact, the quality of the food at the end of the day. So it is always better to have it local, to have it fresh, and of course nutritious and balanced. So a lot of, if we can grow our vegetables, our short crop vegetables like cucumbers and even fruits as well, watermelon and cantaloupe and all the other foods that do contain the phytonutrients, I said, the rich colors that helps to fight cancer, would be so beneficial. And I always say that you don't need a whole plot of land. You get some tires, you get a small space around your home. I've seen persons plant tomatoes in flower vases. So whatever innovation that would allow you to, plant your own food would be beneficial. Like we say, we want to grow what we eat, and we want to eat what we grow.
I know lots of people do the research. They will see that strawberries and raspberries are great in the phytonutrient aspect. What would be our local alternative to these foods?
Yes, so like you allude to, strawberries and blueberries and blackberries, yes, they also contain the polyphenols that I spoke about, the phytonutrients that are anti-cancer fighting. However, in our local jurisdiction, our local setting, vitamin C in a day, we have things like bananas, pineapples, golden apples, as the local fruits that we have around us can be alternatives to the imported fruits, for example, the grapes and the strawberries and so on. So we can utilize our very local wax apples and guavas, like I said earlier on. So we can use those that are around us, the local ones, the mangoes and pawpaws and soursop. These are all nice tropical foods that are, like I say, fruits that are filled with also the nutrients that are important to help to fight cancer.
I'm often told too much of a good thing ain't good within itself. And so I know lots of people now, when you know, it came out, a study came off a few years ago on how the soursop is so great and would prevent you from getting cancer, that people went totally crazy. Soursop was, morning, noon, and night. So in terms of being able to balance those foods out, Fadia, as we close off with you, talk to us about how we can maintain that absolute balance and be comforted that the amounts that we're taking is actually helping our bodies without overdoing it.
All right, yes. So in terms of balance, we have each individual has a certain amount of what we call calories. And calories is basically the energy that we get from the foods we eat. And most times you will find there is overconsumption of food, overconsumption of calories. So you want to strike a balance. So let's say over the meals that you eat within a day, and that starts with your breakfast and ends with your supper in the evening. So you have breakfast, you have lunch, and you have your supper. And some persons opt for snacks in between. So all of that, these meals would form a certain number of calories that you would have consumed for the day. So you want to strike a balance with all of your meals. And to help to do that, we go back to so you want foods, your staples, for example, ground provisions and rice and bread, but you want to choose the healthier option, So you want to choose those that are whole grain, multi-grain, with seeds and nuts and so on. So, and then you also have what we call our vegetables. Is 3 to 5 servings, but now is increasing. Even when you look at the American Dietetic Association, they're recommending as many as 9 servings of fruits and vegetables in a day. Now think about it. Think about what you eat throughout the day. Some persons may not even eat a fruit, maybe within a week setting. So that is why it's important to strike the balance within those food groups. You want to add some peas to your diet as well, and in whatever form, however you cook it, whether it's by itself, whether it's in a bouillon, and so on. And then in the evening, also you want to add some to the day. We should have less food eaten, so that we will not overconsume the amount of calories. And speaking about the calories, it has to do with a formula for each individual, as per, of course, your physical activity and other factors that would come into play there. All right?
Thank you so much, Fadia, for that wonderful information there. Great advice. That was Fadia Campbell, who is a nutritionist within the Ministry of Health, Wellness and Elderly Affairs. And we say goodbye to her simply because of that instability there, the internet connection.
I was wondering, Lisa, if you don't mind me chiming in a bit on that.
Yes.
Maybe a decade ago, the regional health agencies were on a campaign to promote a concept called farm to table.
Yes.
And that was in an attempt to not only encourage fresh eating and eating locally, homegrown. It's more important for us to identify and acknowledge that this was an opportunity for to establish a nexus between education, agriculture, and health. Currently we still operate in silos, where the health ministry sees about cancer and it's only the health ministry. But in order for us to be successful in this fight against cancer, we must establish that interrelationship. Among these agencies, in the schools, we have to encourage less sugar-sweetened beverages, healthier eating in our canteens and so on, in our shops, tuck shops and so on. And our agricultural ministry must find ways to be innovative in the kinds of foods that are made available to us on the local market, so that everybody has an opportunity to consume affordable. It turns out that the healthy eating is expensive, and that's the reality of the situation. So we must find ways to promote healthy eating, and not just from the standpoint of health, from the standpoint of the commercial sectors, our Chamber of Commerce, to look how corporate entities may change the way we consume food. Last time I was here, we identified an opportunity. You identified that a large part of our eating is imported, and so we only have one distributor for food on island. Therefore, if we engage that distributor, we might be able to encourage healthier options for persons to access in our eating. So there are strategies that we could put in place to ensure that we have a better opportunity to eat healthily, and our nutrition becomes our medicine. Our food becomes our medicine, as that advertisement says. And I think it will change the pattern of illness.
Certainly true. I wanted to ask Francis about, and we want to talk about the support aspect now. Once you received your diagnosis, Francis, in terms of the family, how did that affect your family?
Well, Lisa, to be honest, like I said earlier, there is nothing that can prepare you for this news. Because I'm telling you, when the doctor looked at me and he told me, well, Mr. Daria, I hate a colonoscopy that was given to me. He said, this is cancer. To me, he wasn't talking to me. Because when he told me that, I would have been doing a colonoscopy to see whether there were polyps, inflammation, torn tissue, or whatever that is causing the traces of blood in my stool. And he also mentioned cancer. When he said cancer, I smiled because he wasn't talking to me. I never thought I had cancer. Because, as I said, the strength that I had, absolutely no pain whatsoever, nothing. I was doing everything like an athlete would have done. An athlete in his heyday. So, when I got that news, my family stood by me. The community stood by me. The people close to me. And I got in touch with the St. Lucia Cancer Society, and I must say thank you to everybody, from Ms. Plummer right down to everybody who gave me good support, words of encouragement, and up to a day like today, they have not turned their backs on me. So this is why I have decided to go on a campaign myself. Just like Pastor Bray, in his capacity as a pastor, would go on an evangelistic campaign to win souls for Christ. I am on a campaign trying to see if I can at least cause one person to do what I did, follow my example, get your screening done on time. Because no amount of money, when you say it is too late, no amount of money. Yes, as Dr. Gabriel said, we have the facilities. It may be a little pricey. We have them. But once you see it has gone too far, there is no coming back. I will give you an example. We all know the great pace bowler Malcolm Marshall. He died of colon cancer at a much younger age than me. Look at Chadwick Boseman, the Black Panther. That handsome young man, full of vigor, making movies, and he was on top of the world. He had all the money available in the US, all the scientists, the experts, the doctors, the hospitals, he had everything available to him, but he was diagnosed too late and he didn't make it. So hence as I said, I am on a campaign. I have been, for this week, I have been on the airwaves, I have been to shows and so on, and then I am still giving myself, making myself available to anybody, whether it be a church, a club, you know, because I feel if someone who has gone through it come and stand before you and talk to you and say, look, here am I, here is the cut that I have. You know, I can show you maybe some pictures. You know, you can say, okay, well, the doctor, this is his job. The psychologist is his job. The nutritionist is her job. But this is one of us. You know, so this is why I am here this afternoon, so that I can offer my advice and my support, just as I got support, as you mentioned, support, just as I got support from everyone around me, I want to do the same. Because my journey from diagnosis to about 6 months. I in May, well, I had my little feeling of unwell from around March, April. But I got the you have cancer. Those 3 words were said to me in May. And then I did not sleep on me. For support, family support, friends, well-wishers. You know, we worked everything very steadily. And then by the 3rd of July, I had surgery. I spent 5 days at hospital, and to make a long story short, when I followed up with my surgeon, I was discharged to an oncologist, and I was given the all clear. When I had a second CT scan done in November of last year, I was so happy when she told me, well, Mr. Daria, you don't need the medication. So I'm a form. It is a little, I mean, this goes, I cannot do very much compared to what I used to do. I cannot do very much because you can't lift up this, you can't push that. You know, so right now you're just like a little robot that is just programming, you know, move one step at a time, learning the ropes and so on.
And I'm sure that must have been frustrating for someone, you know, who's so accustomed to being up and
you know how much my family quarrel with me every day? Why are you doing this? I mean, what?
The important people could not on this hospital bed. I could not be at home. It was driving me out of my mind because in that little short space of time, it's like I stopped being me, and I couldn't allow that to happen. And so for me, this is almost like my therapy. Coming to work, keeping my routine is my sort of, you know, getting me up and running. So the importance of individuals while you are going through all of these emotional upheavals, keeping routine, does that really in effect help, or are you simply suppressing these emotions, or you not dealing with the issue before you?
I would want to say the answer is yes and no, and I'll explain that across the adjustments. It's difficult adjusting to something new. It takes a while. For some people, it may be days, months, yes, but the adjustment period can be quite troubling emotionally, and one would have to settle with the reality in order to feel better or to enjoy life as before. So one would need to come to the realization, or at least to some level of acceptance, that this thing that I was just told, it may just be true. if you don't want to believe it's true. It may just be true. So here are some things I need to do. I may not be able to do everything as I used to, but I need to do something. So the routine can help if it is that there's an acceptance or common acceptance. So this thing is not the individual. Again, the psychological is important. I react to what that's important in my healing as well. Health psychology research shows that individuals who have a positive mindset towards the diagnosis of cancer of any sort, they tend to live longer lives or respond better than individuals who have a negative mindset adjustment towards it. So it really helps if the emotions are not suppressed. It really helps if the emotions are processed with an able person, qualified person. It helps if there is much spirituality that the individual presents the information to God in prayer, supplicating, believing, whilst still attending to those medical needs, and not just believe, I'm not going to treat it anyhow, I'm not going to treat it in any case, I'll just pray about it. So the relationship has to be thorough, spirituality as well as psychological and other physical treatments, as much as it is important that I don't stop my life, but I must pay attention that this thing is real and I need to do something about it.
I know people always feel sorry, and sometimes as a cancer patient, you just don't want people to feel sorry or to treat you as if, you're some broken doll or something. But people generally, perhaps they don't know what to say, they can't find the right words. And with family members, that too is always so often, and especially those who may be giving you care after your surgery and so forth. It can too. It takes a toll on the family.
Yes.
A cancer diagnosis is not just for that cancer patient. Mm-hmm. All of the loved ones around them are going through that as well. Mm-hmm. So how do you now extend that sort of the psychosocial support to family members and loved ones?
Yeah, very good question. I've had to deal with a few of those cases last year. It's important to help the family process how to respond to you. Will come into play. The family must be given time to process those things. It will not happen at once. Sometimes it may be best not to have the family members express how they feel. Individuals diagnosed because just into the new life, to the new future. So sensitivity becomes quite important. Timeliness, the appropriateness of every word cannot be undermined, cannot be overvalued. It's important that everything be done well, not because you are afraid of how the person may respond, but because you are concerned that if you say the wrong thing, negatively impact the healing process. So it must be well handled. Processing, and the ultimate aim is to help the family come to the realization, again, based upon what the diagnosis is, that it may be possible, it may be that you lose a loved one and it's necessary to put some things in place discuss matters that may be outstanding, or speak to those things, again, based upon the diagnosis, speak about how we will move along in the future, what we will do differently around, how we will eat differently. All of those things will come in should be discussed in a selfless way to help create the environment, the space for the complete healing and restorative care that the individual needs.
Is it possible to be completely detached from the situation and sometimes have absolutely no emotion about anything? It's almost as if, well, you throw your hands up in the air and just like whatever.
That is, it's possible. It's also along the spectrum of adjusting. Sometimes not wanting to admit can, you know what, whatever. Sometimes not being able to deal with it, throw your hands in the air. Those are emotions that will be along the spectrum. However, it is not because the individual is not aware that something is happening, but look, I don't know how to deal with this. I don't know what to say. I'm going through this, so just allow me to go through it. So family members sometimes can be insensitive because they are concerned.
You just want to talk and talk and talk, and you feel like...
Because sometimes they don't know what to say. And they're concerned, they want to share the information. You're concerned that they're concerned and that they don't know what to say to you. You're concerned that you want to say something to them, but you don't know how they will interpret it, how afraid they are for you. So it's a confusing experience. Emotions are at play, and so having an able person to help process all those emotions and set a trajectory for where the family is going to go, what the family wants to do, it really helps in managing the future of the cancer patient.
Dr. Gabriel, you know, and again, I want to refer to my case. I felt like I couldn't catch a break because the first off, I ended up doing a surgery, my ovaries, twisting around the ligament, then discovered the cancer in the ovaries. And then, thank graciously to you, you advised that I go ahead and have that womb removed. And I listened and did that because the more aggressive cancer was in there. But that aside, of course, I had to recover from the 2 surgeries, so I really feel no sympathy for you. Within a short space of time, the 2 surgeries. I want to walk us through that kind I know that there's please give me the explanation.
So I mean, specific pathologies and cancers have associated conditions. Some of them might be associated with high blood pressure, some of the high cholesterol, some obesity, and high blood sugars and so on. So, I mean, sometimes when you do get into crisis and the stress factors, they can trigger, an acute episode of some of these things. Other times, some of the medications that we use may contribute to, those things getting in disarray. So there might be a combination of all of these, so to speak. I'm very happy that Dr. Bray has clarified some of these psychological issues. I think there are also other layers in some cases. Specifically with relationship with the husband-wife relationship. If you have a mutilating surgery, like a woman who loses a breast or both breasts, then you have to see how that relationship between the husband and the wife persists. And there are changes. A mother, a child, a daughter, a father, a son. And so, and odor. And sometimes some of these tumors have ulcers and they rot in, and it's offensive to the household. that the person stays in there. So there are other layers of psychological trauma and emotional trauma that, you know, that have to be dealt with by a professional, I would say, and persons in the caliber of Dr. who can help persons, because certainly as far as they can, and then you know, sometimes the manifestations, hair loss, for instance, is quite something that, you know, the whole awareness of self. Look, you know, I can't recognize myself in the mirror. I think you spoke to this earlier.
Yes. And you know, for women, we're all about our hair. Thank God for wigs.
So there's so many factors to consider when you're dealing with cancer. It is, you know, it's like an onion, let's say, and there's so many layers to go through. You know, and we all need to work together in the family, especially the groups that help give support. And it's not just in the hands of the clinicians and the surgeons, but we certainly need that. I think it's almost more important to have that kind of psychological and emotional support for our patients.
And you say that, and Dr. Bray, I'll give you a few moments. I can see that Roger is signaling to us we have 5 minutes left. So in our remaining moments, I know the time goes by quickly, to Dr. Gabriel's point that, yes, when you look at yourself in the mirror, you are no longer the individual that you know. You wake up one morning and you just see all that clump of hair right there on the pillow after you've done chemotherapy and so forth. Scars, you look at the body and see that you're scarred, and that's a reminder of that sort of dark journey that you had to go through. So how do we now begin to sort of change that mindset, dealing with that change of individual?
Yeah, so the treatment would be individualized based upon where the person, for example, where the person is at or was at before the surgery and the diagnosis. For example, a person with a huge ego, to use that balance, would have great difficulty, again based upon the personality, great difficulty accepting, well, I'm not able to do this. Why do I look this way? I'm concerned about my looks. My looks are very important to me and not just what I see, what people see. So it's going to take an adjustment to that. There would need to be some reframing of one's perception of themselves. There would need to be an understanding that I am more than what I see on the outside. Internal values to be processed and discussed. We would need to look at the worth, self-worth. That is because some persons, they project on the outside how they feel on the inside. Some persons simply live on the outside. Based on who the person is and how they've lived, you are better able to help them understand. For example, a bus driver or a driver who's not able to be actively involved in the lifestyle anymore, going and do things, as it's going to take a toll on the family, the economics of things. He looks at himself and see, well, now I have, my body looks a particular way. You have to help him appreciate that he is more than just what is on the outside. That is not always an easy task for an active person, and it's never an easy task for a female who is very conscious of how beautiful she was before the diagnosis, the chemo, the surgery, if necessary, and all of that. Dr. Gabriel said it very well. Family dynamics would have to be discussed. The role adjustments would come into play. Acceptance of each other despite the loss. All of those things would come into play. But let me hasten to just say, if we would minimize, cancer and diseases on a whole, I believe we can go a very long way in helping persons deal with it or get into preventative care, so that as my brother here went into check, we would go in and check very early. I know if my doctor is listening, he knows that I'm overdue. But I met him and I told him that I'm coming to see, but have not been. But that so that we go in and we do that sort of thing, and not stigmatize illness, to know that only some people can be diagnosed with cancer and others not. I think it can really help us if we remove the labels, the negative labels, those stereotype type of thinking on those illnesses, and see cancer as another type of illness which can be prevented in a lot of ways if we would take care of things. And if we could not have prevented for whatever way, but we can still have healthy, productive lives despite a diagnosis, and our families can still be supported and receive the kind of help that we need.
I find that owning your stuff really helps, that sort of saying, owning your stuff. And just being open sometimes really does help the patient to be open with your diagnosis. I remember when I realized that after chemotherapy that I was having memory issues, couldn't remember certain stuff, be speaking mid-sentence, I forgot a word, and I went to my co-workers individually and I said, but this is what's happening to me. Right. And in the event that I've forgotten something, please bear patience and that sort of, and that really helped because I got their support. Helped me out. So sometimes even if we on air and I've lapsed, then Homer, my trusted sidekick, will come in, knowing that okay, I'm having a moment. That does really seem to help the patient. If you are open with what the situation is, there's a lot of help that's available out there, if we just ask for it.
Well, I like the last point that you made. Being open about it is important. I think a lot of diseases or a lot of ways we can help ourselves, we don't get to help ourselves because we're so closed up about it. The negativity, the stigmas attached. If we remove those things, individuals will be more likely to discuss. Let's talk about cancer. Let's talk about prostate cancer. I mean, it's something that a lot of us men, we don't want to talk about. Let's discuss it, because at some point in time it may happen to us, if not us, but some family member that we know. So the first time that I went for a prostate examination, I had to convince myself when I thought I'm going to do this. Time. So just go.
How much time left, Roger? I want to be able to. Okay, he says that's it. So that. Campbell, nutritionist within the Ministry of Health, so much for the advice and the time. I want to say thank you so much to Mr. Francis Dyer, a survivor cancer, who is on that mission to get the word out there. Thank you so much, Dr. Franklin Bray, who is a psychologist and pastor. And as always, Dr. Owen Gabriel, oncologist. Thank you so much for joining us.